Hello friends, this is Dr. Shadab. I welcome all of you to my YouTube channel, Health Knowledge channel. Today we are making a video in English language so that I have got so many requests from so many people from Facebook, from YouTube, and because the people, there are a lot of people who are suffering from this problem, but they don't have got the panacea for that as yet. So they have requested me, they have advised me, a lot of people who are my friend, whom I know, or there are a lot of whom I don't know. So they have asked me to make a video, the version of the video in English, so that every person can understand it, because English is the language which is spoken all over the world. So today we'll try to cover up all the things which are going on in the back pain, spondylosis, or there are the slip disc or disc herniation, disc bulge, or back pain, lumbago, and L4, L5. You might have heard about L4, L5, L5, S1. These things are going on. So today we'll try to cover up those things. Let's come to the main point. The main point is that our spine is consist of so many vertebrates. In the upper part we have cervical, cervical. Then below cervical we have thoracic in the spine, thoracic vertebrates, and then we have lumbar, then we have sacrum, then we have coccyx. 90% of the people have a problem in their L4, L5, means lumbar 4 and lumbar 5, and people also have S1, sacrum 1, S1, L5, S1, L4, L5, S1. These three vertebrates, L4, L5, S1. 90% of the people have the problem in L4, L5, or S1. Sometimes they have L4, L5, sometimes they have L5, S1, sometimes they have in L4, L5, S1. So let's discuss what is this, what is the problem. So the problem is that this is not a disease which has to be taken care by the medications. You're taking some syrups, or you're taking the medication. So the problem is that when or curvature, the position which is proper, there are a lot of things, like when we are walking, we are not walking proper in a manner we should do. Like there are a lot of people who lie on the bed, the mattress, which is so soft, and their spine is going up, down. So the position of the spine is not proper, so it causes pain, it causes muscle pain, it causes slip disc also. And when we lift very heavy, so heavy weight, but the position is not so proper, so there are chances that the disc can be dislocated, it can come out, it can rupture, or the gel which is inside this bubble, this we call it this one disc, which can puncture out, and so there are pressure on the nerve. The sciatic nerve is going from your brain to your L5, S1. Then this sciatic nerve is going to both of your legs. So when some person has L4, L5, or S1, when he has pain, when the disc is protruded, or like the disc is bulged, so people go to doctor, they go to orthopedic doctors and they go to neurologist. So the orthopedic doctors, they examine the person, and they try to lift, they will make a person lie on the back, just he'll be very comfortable, and then the doctor will ask the patient to lift his legs one by one, first right one, and then left one. He'll try to see up to how much extent the height the legs are going, and if the person is not able to lift his feet like 20 to 30% or 40%, so it is thought that the person has slip disc. Some people say go to the X-ray, go for the X-ray or MRI, CT scan. A lot of things are there. I think the best, what I have seen, I get so many the reports from the people, from the patients, so they just share their MRIs. Yeah, this is the MRI, is the imaging. This is the proper X-ray of the nerve. It shows the bulge, how much is the bulge, if it is compressing the nerve, which nerve it is compressing, and what the problem the person may have. So this is the symptom, I'll be telling you about the symptoms of this problem, but now we are talking about how it happens. It can happen while you sneeze. What? Yeah, listen to this. Doctors say, experts says, if you're standing still, you're standing, and you have sneezing, so the chances are there that you may have disc slip or slip disc. Yeah, so usually it happens with the athletes or the sport persons who are running, walking, doing the physical exercise, and the cops, the policemen, they're going for training, so they have so much weight on their backs, they're running, they're walking, so the chances are very high that the person will be having this so-called slip disc or disc bulge. Disc bulge, when the disc comes out, it bulges out of your vertebrae, and it is shown into the MRI also that your disc is bulged, and it's the nerves are compressed by this like the gel comes out of the disc. Okay, so we have learned it happens. It may happen while you sneeze, it may happen while you stumble, or you just fall down, or just the position you are sitting into your car, or the position you are sitting in your chair, your easy chair, or anyhow it can happen. Okay, so we have to be very careful while playing, while sitting, and the main reason is that our lifestyle, we are not regular to walking, brisk walking, running, but we sometimes we play, we run, and because our body is not addict to this kind of exercises, so we also have the problem like that, and so there is no specific reason that you may have the slip disc. It can happen to anybody. Whew. Okay, now come to the next point, the symptoms. Symptoms are very bad, worse. The person has pain in his back, in lower back, and in the disc part, and there is numbness, and the pain radiates from your back or from your hip. Then the pain is radiating from your hips to your thigh, the beneath your thigh, then through your we call it knee, through under the knee or into the knee, then the pain is coming to your calf, then the pain is coming into your foot, and it is also reaching your toe. The pain is so severe, the pain be like very low electric shock to like a bullet, someone fires a bullet. So the pain is so severe, like people say to me that they have experienced a pain which feels like someone is someone is cutting the skin or the muscle with a very sharp sword. Yeah, it happens. So people call it, this is the this problem has so many names, sciatica and langdi ka dard, a lot of things. You can Google that, like what it's called in native languages. Okay, this is not a disease, my dear friend. That and what happens when person has this kind of problem? So he gets inferiority complex, and he does not want to live because he has so many problems and he wants to come out of it, but there is no one helping him out in this situation. He thinks, OMG, what's going on? He goes to the doctor. Doctor says, okay, keep on taking this medication, the painkiller, this, like that, steroids, and blah blah blah. A lot of things are there, and because no one has the right guidance, and when for want of right guidance, the patient gets, he prones to the this kind of problem, inferiority complex. This is really bad, and this is happening. I have seen so many people because when they go to a doctor say that okay, you'll be good, but take medicine. How much time the person can take medicine? This is out of the blue. What's going on? If a doctor says to him, you need to take this medicine for 3 months, so the patient will be having confident that he'll be confident enough that okay, after 3 months I'll leave the medicine and then I don't have to take the medicine anymore. But the doctor says, okay, just take this medicine, keep on taking like that, and you cannot take the painkillers every time, like twice a day or one time a day, because the painkillers, they are very bad for your body, for your kidneys, for overall your health. They're not suitable. So you cannot take for so long, for years, for a couple of years. This is bad, because every doctor says advises not to take the painkillers most of the time. So, but in this problem, when someone has slip disc, he has so much pain, and the pain is radiating, and he's not feeling good. He cannot walk, he cannot sleep, he cannot sit, he cannot rest, he cannot talk to his friends, and he's fretful. He feels bad. He does not want to talk to anyone because he does not have solution. Actually, nobody has solution. What's that? Like no one has, because I'm saying, because people do not guide well. If you know what's going on with him or with her, with the patient, so you can help him, right? Now I would tell you, actually it has the solution. There are so many treatments I know of, and I have treated so many, alhamdulillah, so many patients I have treated, and they're good. But one thing to note is that once a person has a slip disc and he is cured, he is recovered from that, and so I advise everybody after the recovery, never lift weight, okay? Because the disc gets very fragile, or it's the very delicate, and once you are over it, like you're good, you have recovered from this problem, do not lift any weight. And your lifestyle needs to be changed. You don't have to bow down, don't bow down. And if you or anybody is having this problem, so the doctors, physiotherapists, the doctors advise a lot of things, what you have to eat, what you don't have to eat, so follow them, okay? You have to lie, or you have to sleep on a flat surface. The surface has to be, it should not be soft, it should be tight, it should be plain. And you can have the small pillow, not the big one, the small pillow, and you can roll your bed sheet and put under your head. Also, don't take cold stuff, like we have ice creams and the cold drinks, because when we take this kind of thing, so they provoke the swelling process. When there is swelling, there is pain. When there is swelling, there is pain. So the doctors advise for heat fermentation, or the ice fermentation. The fermentation, it's good, and you should do it, because to relieve the to relieve the swelling, doctor advise a lot of things, and which actually work. Okay, now we know the symptoms: pain and no gain. Okay, now come to this: be optimist. You're not ill, you're not sick. Be positive. You will overcome it, you will recover, and I'm sure you will do it. I'm confident. Only 5% spine cases require surgery. Listen to this again. 5% cases of all world's cases relevant to spine injuries, or these kind of spondylosis and all other things, only 5% problems require surgery, or spine is designed like in a manner that it does not require surgery all the time. So this is good. If you are having this problem, be cool, smile, cheer up, right? Because when you smile, so you feel good, and when you feel good, your body function starts functioning properly. The positive, when you're positive, your thoughts are positive, so your body helps you recovering your problem. Okay, now come to the medicine. Now this is the last part of the video, because everyone comes here for the solution, the medicine. And first thing I have told you that do not get panicked, don't feel bad. Okay, you have been into it, and thousands of people are there who are suffering from this. Okay, so do not feel bad, be happy, be cool, be positive, and I know that, rest assured, you will recover from it. Okay, you can talk to me, you can I'll be writing my WhatsApp number into this. I'm from India, and you can call me, you can text me on my number, you can email me, because I have so many people, patients who had actually this, and most of the people have been they have recovered from this problem. And you will also you'll be one of those who will be recovered by God's grace. Keep on praying to God, then he'll give you the way. Okay, now, because as in the beginning I told you that I'm a homeopathic doctor, I'm a homeopath. So the medicine for slip disc, if you have L4, L5 problem and the pain is radiating to your either of the legs, like right leg or the left one, so the first homeopathic medicine which I have been giving to the patients, and they are getting better day by day, so this is Gaultheria. First medicine is Gaultheria mother tincture. This is, you can find it online, you can find it anywhere, like from any of the homeopathic medical store. And if you're not getting it, you can contact me, I'll send you for it. There are so many people, there are actually so many people, patients who cannot get it, and they don't know like what company, what doses, what blah blah blah, the things are there, so they ask me to send. I got a team who sends the courier the full your medicine to your door within a week, or within a month if you're abroad, or within a week if you are in the country. So do not get panicked. Now we all as a family will be helping you recover from this. So the first medicine I have told you is Gaultheria. Gaultheria help you relieve the pain. If you have a pain in your back, lower back, or in your left leg or calf or feet, or both feet, or left, right, anywhere, if you have a pain caused by slip disc herniated, any pain, but it has to be relevant to this problem when disc vertebrates are relevant to it. Okay, the next medicine is Rustox 200. Get Rustox 200 and take 5 drops twice a day onto your tongue. Just drop 5 drops on your tongue twice a day, and meanwhile you need to take this couple of weeks. Within 4 weeks you'll be feeling very good, very better. You'll start walking, not running exactly. Don't run, right? Don't try to run. Don't try to provoke your body to do something. Just you can start walking and you will feel good, and I do believe that you'll be getting rid of this. So 2 medicine I have told you. One is Gaultheria mother tincture. Okay, I tell you how you have to take it. Gaultheria mother tincture, you need to take this medicine thrice a day. Gaultheria mother tincture, take 15 drops from the bottle and have half cup of water and pour 15 drops into the cup, and just drink it thrice a day, in the morning on empty stomach, and then after lunch. At least there should be at least an hour gap. You have taken something, your lunch, like you take lunch at 1 o'clock, so take it at 2 o'clock, And do not take anything after 30 minutes of taking this medicine. Before and after 30 minutes, or at least an hour gap you have to maintain. Then in the evening, just take 15 drops, half cup of water, drop those drops into the water, okay, mix it, drink it. That's all. Thrice a day, this one, Golthidia mother tincture, and Rustox twice a day, 5 drops on the tongue directly, and you'll be well, right? Okay. So this is all. I think this is all. And the problem is so severe that I cannot explain each and everything in the video. So I'll be actually, I have made in Hindi I have covered up these things in Hindi, but because the time is, it's more than 20 minutes. Oh my God. So I will try to cover up, the next. If something is left, I try to cover it on new videos, another videos. So if you want to know anything, if you want to suggest me something, or if you want to talk to me, I have shared my number, my WhatsApp number, my contact number, my phone number into the description. And yes, subscribe my channel, share, like, comment, so that people who needs it, a lot of people, there are thousands of people who need proper guidance. So you'll be, if you will be right helping them getting the information, they'll be praying for you. And this is exactly what everyone wants. So we'll be meeting you, we'll see you in the next video, maybe next week or tomorrow. I'm not sure about it, because I get so many people who are coming to me and like patients, so we get so much little time in making videos. So be good, be healthy, stay healthy, and we'll be coming, you'll be receiving our next video if you subscribe our channel. And this is Dr. Shadab, and thank you so much for listening. Thank you. Bye.